All right, I think we will get going. Thank you all for being on, and then welcome to our webinar on the next steps you must know when you are losing your job or transitioning from your job because of these upcoming vaccine mandates. First, just like to say thank you for being here. I also like to say congratulations for being here. I truly mean that. Everybody is super busy out there today, and you guys are taking time out of that busy schedule to be here today to learn more about your personal and financial lives here. So that says a lot about you. Now, we have a lot to get through here today, a lot of good stuff. But before we get into that, just first want to touch on who we are, introduce ourselves, and introduce our firm. So my name is Ryan Hitchcock, and I have my colleague, Matt Laverne, with us today. We are financial advisors and wealth managers through SagePoint Capital Group. We are a local financial planning and wealth management firm. We are based in Milwaukee here. We have some satellite offices around the state. We have about 30 other advisors, over 50 people altogether. But mainly what we do is general financial planning, retirement planning, investment management for our clients. We have about 1.5 billion actually in assets under management. But that's not all we do. We do have a commitment to our community here to offer education. So we use webinars like these, webinar like this, where we're really just trying to provide educational material to help people in our community, help them make better decisions throughout their financial life. So that's what our goal is today. You are not going to hear any product pitched here today or buy anything or investments to purchase. That's not it. We will give you an opportunity at the end, which I'll talk about, some special opportunities to do a complimentary consultation and a couple other interesting things we'll offer you, but that is it. So again, this is me, Ryan Hitchcock, and I've been doing this over 10 years, and my partner, Matt Laverne, has actually been doing it over 17 years. A couple of housekeeping things. Please note that this information is not intended to be tax or legal or investment or retirement advice, if you read that down below. And do know that this is being recorded. We have to let you know that for redistribution purposes. So let's get into it here. So our objectives, which we're going to talk about here in a second, but taking a step back, kind of why we are here is, our current administration is unveiling a new action plan, they're calling it, to confront COVID-19, and they're mandating vaccines for federal employees and federal contractors as well, most healthcare workers, and then any employee that works for a company that has over 100 workers. They're going to be required to get the vaccine or tested weekly. Now, we're not here to talk about the politics side of it. These are just facts. Where we see it is that, we've been talking to a lot of our clients. We have a pulse on, the employment market. And what it's really doing with these mandates is just causing people to kind of pause and see what they want to do in their current life and their current work situation and their current happiness. So they're really looking at their situation, and they might be transitioning. And so this presentation is really geared to go over the three things, or the three items, three topics that we think people should really know about and be educated about when they are transitioning from employment. So the first one we're going to talk about is what you should do, if anything, with your previous employer's 401k. We are going to talk about some health insurance must-knows, and then some post-employment questions, or where to turn on like unemployment or termination, some things specific to our current environment. So let's get into it. So what should you do with your old 401k, if anything at all? So the first thing to do is really just know what your options are. And the first thing that you have to realize is that once you are separated service, that's what your company will call you, is if you leave a company, is that you're separated service, that 4 options will become available to you, which I'll go through. But I also want to note that if you're over the age of 59 and a half, it's just good to know this, that all of these options, these 4 options we'll talk about, are available to you as well, even if you're still working at that same employer. So just take note of that. So your first option with your old 401k, if you were to leave an employer, the first thing you can do is leave it there. You can technically just leave it as is. Why that could be good is traditionally 401ks have low relative fees, and they can do this by just pure scale by having a lot of employees and a lot of money, 401ks can push down the fees. Some employers actually might pay a portion of those fees for their employees as well. So that's a good deal. However, you have limited investment options inside of a 401k. Traditionally, there's a menu of about, let's call it 15 to 20 different options at the most that you can choose from. They're usually pretty cookie cutter index funds, your traditional large cap, mid cap, small cap, like that. Not going to get a ton of specialty types of funds or investments inside of there, but that simplicity actually can be kind of nice at times. A bad thing is you really have no say on the plan sponsor, which means that, let's say your 401k is with Fidelity and it has been for your whole time working there. And if you leave there, down the road, maybe they get a new CFO that has a deal with Transamerica. They can move that 401k from Fidelity to Transamerica, and you have no say over that. So just something to know. Your second option, you can technically roll it into a new 401k or a new employer's 401k. Now, same rules apply. You'll have the relatively low fees inside of 401k. Same thing with limited investment options. You're not going to know or have any say on the plan sponsor, but you're going to have one less account out there in what I call no man's land. So having some consolidation might be kind of nice. However, one question to ask always is if they're going to lock up your money or not. Sometimes if you were to put an old 401k into your current employer's 401k, they might lock that money up until either you turn that age 59 and a half again, if you retire, or if you leave that employer again. So that is one thing to note. The third option, you can cash it out. Now, let's say you want to just take the money, use it now, maybe you need to pay down debt, you can do that. That's also an option. That money is going to be taxable when you take it out. Now, for example, it's just for easy math. Let's say you made $100,000 of income in this current year, 2021, and then you cash out a 401k of another $100,000. The government is going to see you making $200,000 if it was traditional 401k money. So just something that you have to watch for to not have to pay too much taxes. And if you are under the age of that special number, 59 and a half, that the government puts out there, you're going to have to pay an extra 10% penalty as well. Now, the fourth option is you can now roll it into your own IRA, or individual retirement account is what that stands for. And what's good about that is it essentially opens you up to unlimited investment options. You have the whole kind of universe of investments open to you, and the whole universe of kind of fee ranges depending on what types of accounts you go into. Some accounts can even be as little as 0%, so that is nice. You're not going to have the red tape of your previous employer, so they have no say, or they can't tell you which plan sponsor to be with or not. You own the account. It travels with you, whichever job you should go to. And also you can, start to work with advisors. This is what we do, is you can help, we can help clients just get more personalized advice on what investment is right for them on their time horizon or risk tolerance and all of their goals. So these are the four main options that I just kind of went through that you need to look through for your 401k. And I'm going to pass off the mic here to my partner, Matt. He'll talk about the health insurance.
All right, thanks, Ryan. When we talk to our clients about, either retiring early, so retiring before you reach age 65, or for those that are transitioning to either just transitioning out of the workforce for a while or transitioning to another job, one of the main concerns that those individuals have is healthcare and health insurance. And there is a lot of myths out there about health insurance, about the Affordable Care Act, about Cobra. So today, I'm going to educate you and give you the facts that you're going to need to know about health insurance if you're no longer working. You need to send me the link again, Ryan. There we go. So here are the three topics I'm going to talk about today. I'm going to touch on, what Cobra is. I'm going to talk about the Affordable Care Act, or the open marketplace for health insurance. And then I'm going to talk about health insurance in retirement. So either pre-65 and then Medicare if you're over 65. So the first type of health insurance that you'll be able to have is Cobra. So if you transition out of your job, you can continue your group health insurance plan just like you were working, okay? What we've found is a lot of times when a person transitions to Cobra, their premium payments dramatically increase, because usually your employer pays the majority of your health insurance premiums. And when you leave your company, now you're going to be footing most of the bill. Okay. We've seen it as high as 102% cost of the plan. Now that extra 2% is, they call it an administration fee. So, typically a 60-year-old single male is going to pay in the realm of like $1,200 per month for Cobra. That's kind of what we've been seeing in southeastern Wisconsin. So it's incredibly expensive. So what our job is to find ways to avoid signing up for Cobra. And there's a bunch of other options I'm going to get into. You do have a 60-day election period for you to apply for Cobra. So I'm going to give you a tip that we've been using with our clients to bridge the gap from when a person leaves their employment to then getting their own health insurance on the open marketplace. So technically, you do not have to pay a premium for the first 60 days after you leave employment. So what does that mean? Let's just use, let's say you retire November 1st and you have 60 days, right, to jump on Cobra. So let's say you decided that, Cobra is really expensive. I'm not gonna go on that plan. What you can do is you can wait until January 1st to get health insurance. But if something major happens in that first 60 days, so from November until January 1st, then you will pay a premium and then use the services. So the reason why that's so important is you can basically get free health insurance if nothing major happens to you health related for those first 60 days. So we've been using that strategy for years and years now, and it's worked incredibly well. So just know that, God forbid, if you have a medical issue within those 60 days, then you just have to pay the premium. But 99% of the time, knock on wood, hopefully nothing happens. You won't pay the premiums for those 60 days. The other thing to know about Cobra is it only lasts for 18 months. After 18 months, you get booted off the plan, and then you're on your own to find your own health insurance. So a better way of going about health insurance is going through the open marketplace. So there's a law in place. It's the Affordable Care Act. The website is healthcare.gov. And basically there is about, depending on your zip code and where you live, there's anywhere from 60 to over 90 plans inside of this marketplace. So some of the things that we hear is, I've heard, Affordable Care Act in the marketplace. A lot of these plans aren't good. They don't cover much. They're still really expensive. That's what we hear, and people are talking, to their friends or coworkers. But in reality, because there's, in between 60 and 90 different plans, yes, there are some plans that are crummy, expensive, don't cover much, but there's also some really good plans inside of the marketplace. So what our job is, here at High Point is to educate you on the different types of plans available. And then we customize the plans that fit your individual needs, because all of you have different needs. Some of you might have some health issues. Some of you might be more healthy. So there's different plans that fit within that parameter. The nice thing about the Affordable Care Act is the cost of the plans. So I just mentioned that Cobra is extremely expensive, right? On average, we're seeing about $1,200 per month for a Cobra plan. With the Affordable Care Act, your premiums are based on what your taxable income is. So let me step back and talk about taxable income and what the IRS deems as taxable income. So that would be any wages or income you receive from your employer. If you take any money out of your traditional IRA or traditional 401k, that would be considered taxable income, or any capital gains that you would have within that year. So the lower your taxable income is, the cheaper your health insurance premiums are. And in a few slides, I'm going to go through some real world examples of clients of Ryan and mine that we've walked through the Affordable Care Act, and I'll show you what their incomes are and what their premiums are and what coverage they have. A new law that was passed in April, it's called the American Rescue Plan Act of 2021. This law beefed up Affordable Care Act. And what I mean by beefed up, meaning is the government has reduced the premiums for all these different health insurance plans on the Affordable Care Act to help those people that have either lost their jobs or are retiring early. It's also increased the thresholds of your taxable income. So more people that make, that are on the higher income tax levels are going to still be getting tax credits from our government to help pay for your health insurance. So this law went into place in April. So this law takes place for this year and next year. In the year 2023, this law will go away, but the Affordable Care Act will still be here with us. So most of the income earners will still be able to get affordable health insurance. So here are some of the topics that we talk to our clients about who want to retire early or are transitioning jobs. The number one thing that Ryan and I want to do is figure out what your taxable income is going to be, because that's important. We got to find out how much money you're going to need on a monthly basis to cover your bills and do the things that you guys want to do. You need to have your fun money. Once we find out what your budget is, now we have to find ways to get your taxable income as low as possible. So I mentioned to you what was taxable income. Well, there are some accounts that are not taxable. So if any of you have Roth IRAs or Roth 401ks and you take distributions from those accounts, it does not show up as taxable income. Also, if you have money in the bank, so if you have money in your savings, checking account, CDs, and you use that money to live on, it's not considered taxable income. And why that's important is if all of a sudden, let's say you're transitioning your job and you need $4,000 a month to pay your bills, have fun. Well, if we can find ways to still get you that $4,000 a month, but maybe taking some of it from your bank accounts or some of it from Roth, now your taxable income will be less. So then your health insurance premiums are less. So we're always trying to find strategies to make sure that you're saving money and still getting the income that you need. It also works the same once you're 65 years old. Once you're 65, you're on Medicare. Your Medicare premiums are still based on taxable income. So the conversation really never stops about taxable income. One popular strategy that we've used over the past 4 years has been Roth conversions. So a lot of times when we meet with people, a lot of their assets are tied up in these 401k plans or IRAs. And a lot of them are in traditional 401ks. Like Ryan explained to you, when you pull money out of your 401k, traditional 401k, it's all taxable income. So there's a strategy that you can do where you can actually take a portion of your 401k on the traditional side and convert it to Roth IRAs or Roth 401ks. Now you do have to pay the taxes up front the year you do that, but then all the next previous years or the years to come, you'll be taking money out on a tax-free basis. So our software will figure out ways to make sure that you won't get hurt by doing conversions, but also help you out because your health insurance premiums will be less expensive for the years to come. So let me give you some real world examples of people that we've helped over the past few months. Each of these case studies are people that are pre-65, so they decided to retire early. And I'll explain to you how we did it and what they're paying in health insurance premiums. So the first case study is a husband and wife. They're both 62 years old. And when we went through their budget and asked them how much income they're going to need on a monthly basis, it came out to this couple needed $80,000 per year to pay their bills, have fun, travel, do all the things that they want to do. So with that taxable income, this family will receive $1,470 per month to help pay for their health insurance. It's amazing. This is the stuff that the news doesn't tell people, right? I mean, people hear about the Affordable Care Act or Obamacare, whatever you want to call it, and there's always like negativity around it. What people don't realize is they passed this, plan to help people, to subsidize the health insurance. So after this family received the $1,400 per month, they're only paying about $150 per month for their health insurance. And the health insurance that they chose was a low deductible plan. So their deductible is only $2,000 per person. So, because it's a family plan, the deductible would be $4,000 for the family. Maximum out of pocket that they have is $5,600. So very comparable to most group health insurance plans. If they have to go to their primary physician, they're paying $30 for that. Prescription drug coverage, if they're on generics, they're paying anywhere from $3 to $5. And then obviously if you're on some non-generic drugs, you have to pay a percentage of that. So, I like showing this because you can get the same type of health insurance that you're used to through your group plans in the marketplace, and it is affordable. The other plan that we just did was with a single woman. She's 62 years old. Her taxable income per year is $55,000. So the government is going to give her $628 per month to help pay for her health insurance. She had some health issues. So what we designed the plan to do for her is, she wanted a super low deductible plan. She didn't want to have a large maximum out-of-pocket expense to her. And she, has to see specialists. And so the plan that we chose for her was actually a zero deductible plan. Yes, there are zero deductible plans on the Affordable Care Act. Maximum out of pocket for her plan is about $5,000. So worst case scenario, if she's going in and out of the hospital or has to stay, for extended periods of time, she knows, the max she'll ever pay is $5,000 per year. And, her health insurance costs came out to about $350 per month, with that $628 credit. So again, very affordable, especially for someone that had a health issue. This woman was literally so scared, so nervous that, when she lost her job, that she would have to go on Cobra and, and pay that $1,200 per month that she really couldn't afford. So when we educated her and showed her ways to, reduce her payments, she was very thankful. And then the last case study I'll go over with you guys is a husband and wife, married couple. The husband's quite a bit younger than his wife. So that does play into account when we look at health insurance plans. That's why I wanted to show you this case study. Their taxable income this year was $60,000. This was a really unique situation. This was a fun one. So they actually needed like $100,000 of taxable of income per year to pay their mortgage. They have car payments. Their son's still in college. They're helping him out. So their income needs were quite a bit. But what we did was, we talked to them. We found out that he had a 401k plan, and within his 401k plan, they allowed him to take some of his traditional 401k and convert it to Roth. So we did that for him. So starting next year, when they're gonna, start taking withdrawals, a big portion of their $100,000 budget is going to be non-taxable, 40,000 of it. So only $60,000 is going to show up as taxable income per year. And because of that, they're going to receive, almost $1,500 from the government to help pay for their health insurance. So their health insurance starting in January is only going to be about $200 per person. So $400 for the family. Their deductible was a little bit higher because they're healthy. So their deductible was about $5,000. So a $10,000 family deductible. Again, it's like $30 if you go to the primary physician, and generic drugs are included. So I like showing this to people and educating them, just because everyone is different. Right? Everyone has different income needs. Everyone has different health issues. So the nice thing about the Affordable Care Act and the open marketplace is there's usually a plan that can fit anyone's needs. Like I said, depending on your zip code, there's in between 60 and 90 different plans. And most of the time, our team here can find out, which one is the best for you. So once you turn 65, you will jump on Medicare. So original Medicare is Part A, Part B. You do have to pay for Part B. It is $148.50 per month. If you're collecting Social Security, it comes right out of your Social Security check. There's also Part D. So that's a prescription drug plan. And there are literally hundreds of different prescription drug plans out there. The nice thing with our team is they shop it out for you. So basically they just spreadsheet whatever drugs you're on. They put it in a spreadsheet and they find whatever drug plan is optimal for your situation, depending on what pharmacy you go to and what drugs you're on. You can also opt out of Medicare, and you can go on what is called a Medicare Advantage plan. Now, opting out of Medicare doesn't mean you stop paying the $148.50 per month Medicare premium. You still have to pay that. But then you can go out and find your own insurance, basically through the open marketplace. Again, there's hundreds of different plans for Medicare Advantage plans. So again, depending on your health situation, whatever hospital system you're in, there's a plan that usually fits your needs. So With that was a lot of information. I'm going to pass it back over to Ryan.
Thanks, Matt. Yeah, so the third topic we're going to talk about is what we're just calling post-employment questions. So this is a little bit more specific to our current environment with some mandates. Now, we are, if I can get my mouse here, we are not attorneys. So big disclaimer, we are not attorneys, and this does not constitute legal advice. However, we have resources. So Matt was just talking about a bunch of health insurance stuff, and we have professionals that we use for that, but we have professionals that we use in the legal world as well that have been really monitoring this situation closely. So if you do have questions in this world, we can refer you out to that. So at the end here, we'll have an opportunity for you to sign up and talk with us individually. And if you need that referral to these attorneys that are following this, we can help set you up with that. However, just a couple quick points on certain things we're hearing and questions that we're hearing, and some questions we think you should be asking yourself in this mandate world. So again, we're not attorneys, but unemployment, we're getting a big question. So like, if people do leave their jobs because of this, can they receive unemployment? And really, you have to ask yourself, to answer that question, you have to ask yourself, how are you leaving your employer? Are you being laid off? Are you being terminated for cause, or resigning? Now, this isn't completely understood yet or known yet, but I have a article that is written by Lisa Guerin at the bottom here, is a link, and she's a JD, and this is a site called nolo.com. It's just a public legal guide site. And she says, employees who are fired for misconduct or for cause are typically not allowed to collect unemployment. What qualifies as misconduct varies from state to state, but could include anything from failing a drug test to violating safety protocol. And if a company requires employees to get vaccinated as part of its health and safety protocol, then not getting vaccinated could qualify as misconduct or for cause. So you just have to ask yourself and talk with your professionals and attorneys how that's going to relate to your situation. The other thing we're getting questions on is termination and possible new employment. Questions to ask yourself in this realm is, was the termination not uniform across the corporation? Does religion, disability, or health come into play? That's for the termination. And for the new employer, we're hearing that if you do have an existing non-compete, a lot of professionals do, that might come into play as well. Talk to your attorney, come to us, and we can refer you out to talk if you want to talk about that as well. So let's recap. We've talked about a lot of stuff here. We talked about what options are best for you in your 401k, from leaving it at your current employer to moving it into your new possible employer, cashing it out, or rolling it into an IRA. These are big decisions. Matt went over the vast amount of information in health insurance. There's a lot going on in there, especially during transition. I mean, in this specific environment, like we're saying, that you need to be asking yourself even some more questions and making sure you know what's going on in your personal situation. There's a lot of moving parts here. So we know at any transition, especially this time, you might be wondering, okay, this is great info, Matt and Ryan, we love it, but what's the right thing to do for my situation? Well, to answer that, you can really do three things. You can kind of do it yourself, right? You can do the research, might take some time, run the numbers, and implement a plan on your own. That is totally doable. You can work with others. Maybe you have other advisors or other professionals in your corner. That is great. We love to see that. Not enough people do have that from our view. So take this information and take it to them and see what they think to help you in your personal situation. And obviously you can work with us. Through these webinars, we're just trying to show you that we have knowledge in this world, let you get a little bit more comfortable with us, and truly know that we can try to help you out. One thing not to do is procrastinate. We always like to throw that in there. Making no decisions is never going to help anything during a transition. So just by being a part of this webinar today, if you sign up, I'm going to show you how you can do it. To sign up for a complimentary consultation, we're going to give you a complimentary, personalized financial plan. We love these things. We have great feedback from them. We use a software called eMoney. It's one of the best softwares out there in the industry to do financial planning work. And, we just talked about the 3 areas that, have a lot of moving parts, and these areas are all interconnected. That is something that you kind of could see as a theme. They're all interconnected. So having a base financial plan that incorporates your personal goals, your financial goals, it's just going to help you make these decisions through transitions a little bit more clear. And so, for example, inside of a financial plan that we run is we can do some cash flow planning. If you're losing your job, we need to figure out where that income is coming from and how that's going to look in your future financial picture. If you're retiring, like Matt said earlier, there's a lot of health stuff and income that come into play there. Let's project that out and see what sources you should be using for your retirement. What if scenarios? This is a huge thing. People love these things because we can literally build into the plan. Maybe you don't work for 2 or 3 years. Then you go back to work part-time for a while. Maybe you sell a house or get an inheritance. We can build that in and really start to draw a picture for you on what your financial picture should look like moving forward and help give you some confidence on that. We haven't talked much about tax, but that's a big portion of this as well. We usually charge $500 for this. This is just the minimum that we charge for any client. It is a pretty involved financial plan, but it's worth it. And so just by being on the webinar today, thank you again for being. We're going to offer that to you when you come see us. And so this is kind of what it looks like. It's an actual deliverable. You get a binded copy of your financial plan. You'll get a PDF copy, and it's going to be saved at our office too, so we can always revisit it down the road. Our whole goal with you guys is really, with our community, like we're saying, is just trying to help take the confusion out of these really complicated topics. Start to get personalized planning strategies. In our view, that's the only way to really make good decisions in your financial and personal life. Start to feel confident about these decisions. That, a lot of people have unknowns and they're scared about them. But once you start to educate people on this, you'll start to feel confident that you're making the right decisions. Stop using Google. This is one of our favorite things. We get it all the time. You read an article that's usually clickbait that really has no substance to it or personalized to you. The other one is maybe your neighbor did the best strategy, or your brother-in-law, mother-in-law, somebody has told you that you should be doing X, Y, and Z. But that is not always the case because everybody has different goals and different priorities and different things going on in their life. And just use the experts in this field. You're not alone in this journey, so stop feeling alone. And so also, there's more. We always say there's more. So when we meet with clients or prospects, we should say that are doing a complimentary consultation, we're really laying out the red carpet. We want to talk about anything you want to talk about. That might include, looking under the cover of your investments. What kind of fees are you paying? We talked about retirement. Maybe budgeting is a big thing for you up until retirement. 401k, we talked about. Social Security, that is huge. Something everybody needs to understand, a complicated subject. Pay down debt. When you leave an employer, sometimes it makes sense to use your 401k to pay down debt. Take it out, cash it out, pay the taxes actually, but maybe you're done with your debt. We want to make sure your beneficiaries are correct. You don't want to have any ex-spouses on your beneficiaries. We see that quite often. We'll give you any tips and strategies, look over any legal, home and auto, tax planning documents we can, refer you out to our network of other professionals if need be. We're really trying to just be a quarterback for you. So how do we do this? How do we put this all together? This complimentary consultation, Matt, Ryan, looks cool, pretty involved, but we try to simplify it. Our complimentary consultation is really 2 meetings. We do it in 2 meetings. Our first one is just whether you want to do it in person, phone, or virtual. I'll show you how we can do that, how you can set that up. And we're just talking about your goals. What are your personal goals, your financial goals? We'll get some of the facts and figures. We'll answer any main questions you have in that meeting. But then we're going to take that information. We're going to go back to our offices here and do our homework for you and come back in a second meeting and deliver that actual financial plan. We'll show you what we found, any things that are of attention or places that we think you can improve your situation. You'll have access to this e-money financial planning software that we can manipulate it if need be in that meeting. We're just trying to help you find better strategies to kind of help your goals financially and personally. You don't know what you don't know is our whole take on this. And after these 2 meetings, we're gonna give you the option. There's no hard sell in us. Is you can take this plan and take it and go implement it on your own. We're totally fine with that. But we'll give you some recommendations. If you don't want to do that, we'll let you think about them. And if you want to ever do work with us down the road, it's a win-win for everybody. Now, last thing too is sometimes people say, okay, that's a lot of stuff that you can go through to build a financial plan. We think everybody should have one, but maybe you don't want to go through all that. You just want to, maybe hear us out some more. We'll have a 15-minute phone conversation. So do sign up for that as well. We'll see if we're a good fit or if we can help you out, maybe answer any questions you might have that are just kind of low-hanging fruit. We can do that. And if we're not a good fit, we'll try to find and introduce you to someone who might be suited for you better. So to do this, right after this presentation, when we hit end on the Zoom, you're going to get a survey that pops up that's going to give you 2 options to choose. You can click this top option. And you can schedule yourself. It'll be a link to right here. You can click on here and it'll be a link to, it's actually my calendar, but it'll be for both Matt and I. And you can match up your calendar with our calendars and put a time in there, whether it's phone, virtual, or in person. You can come into our office or we can go to your house too, by the way. And we'll do that first meeting for you. The second option is if you don't have time for that, or maybe you just want us to reach out to you, you can click this part here, click yes, give us some of your personal information of name and phone number and email, and we'll reach out to you and try to contact you as soon as possible. And don't worry if you do miss this survey that pops up. You'll get an email right after this webinar that'll have the same links in there to schedule a complimentary consultation. So that is it from us today. We tried to give you a lot of great information, let you know that we're here to help. Here's some resources we have, and thank you for being here. We'll take any questions if need be, but if not, thanks again for being here, everybody.